Hey guys, Dr. Novo DPT here with a video to discuss a novel approach towards using a treadmill for hamstring eccentric training. Now, in the issue number 42 of JOSPT, in a 2015 case study, that's an N of 1, some researchers used a whole host of eccentric hamstring training to help this individual rehab from a proximal hamstring tendinopathy. Now, we see proximal hamstring tendinopathies occur oftentimes in individuals, either long-distance runners, or this could be CrossFitters or Olympic lifters, who just don't recover very well from an initial acute injury and continually have this chronic acute exacerbation that occurs to that tissue, just making it really thick and gunky. So that's where eccentric training comes in. You can read more about it in literature in terms of the whys and hows, but this video is just going to cover the actual exercise that they used because, I mean, we all have treadmills either in our clinic or in our facilities, and what a cool way to actually be able to use this, which helps individuals stay in an upright position and load that hamstring eccentrically and help to really regenerate, right, and remodel those tissues to help them get back to what they need to do. So let's get to it. For background of some anatomy, here we see the hamstring muscle on the right leg. Proximally, we're seeing that the origin is at the ischial tuberosity. Medial aspect of the leg, we have the semimembranosus tendinosus, and laterally the biceps femoris ending in the insertion. The common pain referral pattern is expressed in this image. You can see here that pain can be sensed up as proximally in the buttocks and lower into the lateral aspect of the leg. This is a really neat chart. You can pause the video here and kind of appreciate the fact of the timing at which the hamstring turns on throughout the running cycle and how this can be attributed to some of the dysfunction and pain. All right, so now that we've seen a picture of how this is done, let's actually get it done. So recliner patient is facing away, holding on to the rails for support. Treadmill is put into the start position at 0.5 miles per hour or 0.8 kilometers per hour as per the study. The client is to then keep their pelvis in a neutral position. They push into the treadmill and continue to push until they reach ankle dorsiflexion. So it's almost as if they are performing, right, just the gait cycle in reverse. Again, maintaining a neutral pelvis as you perform the exercise. It would be done again 1 to 2 times a day for 3 sets of 12 to 15 repetitions. Well, now that you got to see how all of it is done, the protocol itself from the study, this was a 4-week study, and what the individual did was 3 sets of 12 to 15 repetitions, if I remember correctly, and they were given the cue to resist the treadmill at or near the same amount of familiar pain that they had, as long as the pain didn't get any worse or progressively got worse with each repetition. So they were cued, as most patients are with eccentric work, to experience some of that loading pain, again, as long as it's not getting any worse. I hope you guys liked the video. You can go ahead and like it on the bottom or leave comments. Take care. Happy lifting.